Hello everyone, this is Avijit Barai. In this presentation, we are going to talk about how to write critical appraisal of journal articles. Now, critical appraisal is a very essential skill that we need to know very well. You need critical appraisal for writing just any good article from the paper which is published. If you want to participate in a journal club, you need to have a very good understanding of the critical appraisal skills as well. If you want to write some article, some research paper, you need to do the critical appraisal of the references that you're using. So critical appraisal is very important, right? So in this presentation, we are going to talk about in details about how to write critical appraisal of a journal article. At the end of this session, you will have a very good knowledge and understanding of critical appraisal skills. If you still have got any questions, you can write in the comment section below, and we'll get back to you as soon as we can. So if you have not done already, please subscribe to the channel so that we can keep you updated about these various presentations regarding critical appraisal and publication and presentation, and also various aspects of emergency medicine and urgent care. I'm a consultant in emergency medicine. I'm also a specialist in urgent care, and I've been working as a medical doctor for the last 20 years in 3 different continents, in 5 different countries. I have done my master's about 10 years ago. And during that time, I found it really difficult to do the critical appraisal of journal articles. My tutor used to give me some task or some assignments, but I did not have any clue how to do that. So I had to do a lot of these trial and error methods. And I found some special techniques to write the critical appraisal, and that is what I'm going to share with you. So this will be our goals, or this will be the objective of this presentation. At first, we will talk about what is critical appraisal and have some brief idea about what it is all about. Next, we are going to talk about why you need it, as we have given some brief introduction that we need this for various purposes, and we'll talk about it in a little bit details. And the most important thing is, what are the steps that we need to take to write the critical appraisal, right? And I'll show you the systematic approach. I will give you a lot of tips and tricks that you can use for writing a very good critical appraisal of the journal articles. And also I will show you a lot of different checklists and examples that you will find useful. So once again, in this presentation, if you are really struggling with the critical appraisal, or if you want to know more about critical appraisal, we are going to talk about what it is, why you need it, what are the steps, or how to write a critical appraisal, different tips and tricks with some examples. So the first thing first, what is a critical appraisal? What this is all about? So there is this booklet written by Amanda Burles from the University of Oxford in the United Kingdom. She has got a very good definition about critical appraisal. So she defined critical appraisal as is a process of carefully and systematically examining the research to judge its trustworthiness. Can we trust it? Is it reliable? Is it valid? And also its values and relevance to particular context. It means, can we apply this finding of this particular piece of paper or particular research paper into our clinical practice? And this whole thing is done in a systematic way so that we don't miss any important aspect. So we can use some checklists, and I'll show you some various checklists that you can use to perform this critical appraisal. So the critical appraisal helps clinicians to develop the necessary skills or essential skills, I would say, to make sense of the scientific evidence. So a research paper can have a lot of materials, but when we try to do the critical appraisal, we don't have to go through everything. We just do the summary of it in a very systematic way so that we can identify, is it valid, is it a good paper or a bad paper or bad science? What are the results and summary of it? And most importantly, what is the relevance to our clinical practice? So these are the keywords here: the validity, results, and relevance in a systematic way. And that is all about critical appraisal. So essentially, when you read a journal paper, if you follow some systematic approach, you will be able to identify what are the strengths of this paper, what are the faults or fallacies of this paper. You will be able to identify whether it's a good science or a bad science. And most importantly, you will be able to judge or explore the options of applying this journal paper into your clinical practice. And that is the critical appraisal. Now let me show you a little bit about the evidence-based medicine. So it is a process. It is not a stationary single point phenomenon. It's a process, and the process starts, any research that starts with identifying a problem. For example, let me tell you about a paper that we have published a few years ago. This was in the emergency medicine. We see a lot of these wrist fractures. We manage the patients and then either discharge or admit, but we do not know what happens to these patients. What happens in the long term? What is the functional status? So that is the problem. The problem is we do not know enough what happens to our emergency department patients, which we have managed initially, in the long term with regards to their functional status. So then we prepare some questions, and the question was based on PICO. PICO is the population. So these are the patients who are managed in the emergency department. Then the I for intervention. Intervention is the management of the distal radius fracture or wrist fracture, which we do in the emergency department with plaster of Paris, either manipulation or without manipulation. And then they compare. So we have compared those who needed operation and those who did not need operation. And then outcome. The outcome is what happens to the functional status. And there are a lot of different tools. The specific tool that we used is called DASH questionnaire. That is the disability of arm, shoulder, and hand questionnaire. And so this is the research question, that what happens to our patients who are managed in the emergency department. What happens to them in the long term in terms of their functional status? And we use specific tool for identifying the outcome, and that is the DASH questionnaire. So to do that, we had to go through the literature search. We used various search engines, PubMed, Sinahol, Embase, and Google Scholar. The Elsevier has got their own search engine. So we have used all these different search engines to identify hundreds of papers. Then we narrowed them down and went through the full literature review. And then when we identify those journal papers, we did the critical appraisal of each and every paper in a very systematic way. And that is the critical appraisal. So we systematically we try to find out what is the reliability, what is the validity of the paper, and if we can use this paper in our clinical practice for our patients. And then we decided what we can do and how it is going to actually affect our patient care. So as you can see, in evidence-based medicine, Critical appraisal is a very important tool, and this is almost in the center stage of the evidence-based medicine. And we need this all the time for our evidence-based medicine approach, for the literature review, and for participation of the journal clubs. So the next question is, why do you need it? Why do you need critical appraisal in the first place? Do you actually need it? Yes, so there are a lot of advantages of this critical appraisal, and that is what I'm going to show you here. So the most important thing is, in any journal paper, there are a lot of information, and these are relevant information. These are very important information. However, when we apply this finding of a journal paper, we need to remove the garbage, and we need to take the main theme, the cream of the paper. And to do that, we need to go through this journal article in a very systematic way, and that is the critical appraisal. So critical appraisal is very helpful to identify the main finding of the journal paper in a systematic way, which you can use into our clinical practice. So there are a lot of thousands of papers are published every day, but when we try to ask a specific question, we try to find out if it is clinically relevant to our practice, right? For example, I was doing one literature review recently on the endpoint septal separation, or EPSS, for the identification of the patient's cardiac output. Now, cardiac output measurement can be pretty complicated, and this is not very reliable, because if you give 10 echocardiologists or cardiologists or sonologists to measure the ejection fraction, you'll get 10 different results. And there are different techniques. There is Simpson technique, there is this M-mode technique, there is this artificial intelligence. There are a lot of different ways. An old school method of quickly identify the ejection fraction is EPSS, or endpoint septal separation. Now, when I was doing the literature search, I found that there are quite a few papers which are done on dogs. So the veterinary surgeons, they did the ultrasound or echocardiogram of the dogs to identify their endpoint septal separation. We did not include those papers for our literature review, because the research which was done on dogs, that is fine for or relevant for the veterinary surgeons, but they are not relevant to our clinical practice. We deal with the human patients. So that is what the clinical relevance is all about. If a journal paper is, so for example, a research is done in Malawi in Africa, and if you practice your medicine in Sweden, the demographic is different. The way the healthcare is provided, that is different. The way the patients present and they respond to the specific intervention or management is different. So we cannot quite apply the findings of a research which is done in Malawi to the patients in Sweden. So that is when the clinical relevance is important. However, if a research is done in Malawi, we can do a same methodology, similar research in Sweden on Swedish patients to find what is the result. And then we can apply the finding to the clinical practice in Sweden or other Scandinavian countries, because they have got a similar demographic and similar type of healthcare services. So that's what it meant. It is meant by clinical relevance, very important concept. And also we need to find out, is the study actually is reliable or not? What does it mean, reliability? Reliability or replicability means if we use the same methodology, we are getting the same result. That is the reliability. For example, if you do a research to find out what is the temperature, how long does it take to cook rice by boiling water at the sea level at the top of the Himalayas, you will find that these are not reliable, because the time which is taken at the sea level will be different from the time it takes at the top of the Himalayas, because at higher temperature the pressure is less, so it will take longer time to cook the rice. If you cook rice in a pressure cooker, it will take less time, because for increased pressure the rice will be cooked very quickly. So that's when reliability is very important. That's when the methodology is very important. When we read the methodology of any journal paper, we need to make sure that the methodology is clear and explicit. Every details, what instrument has been used, what is the manufacturer of that equipment, what is the drug we used, who is the manufacturer of the drug, what is the dose of the drug, what is the route of the drug, what is the duration of the administration of the drug. So these are the fine prints that needs to be explicitly mentioned in the methodology section, so that if some other researcher performs the same research, they can follow the same steps to find if it is reliable or not. So any good research paper has got a very explicit description of the methodology, and that is when we can identify how reliable the paper may be. The other aspect we look for is the validity of the study, how rigorous the study was conducted. There can be internal validity and external validity. And also there are a lot of garbage which is published, and to differentiate from the garbage to the good science, we need to go through this in a systematic way so that we can identify what actually is a good piece of evidence. One of the things that we look for in the critical appraisal is to identify the bias. Again, a good paper actually will have a section where they will mention about the limitation of the paper, including the various bias. If the bias was not mentioned in the limitation section of the paper, we need to identify the bias, because that bias can affect the ultimate result of this research. So that is also one of the reason that we need to identify, we need to go through the critical appraisal in a systematic way. And I think the most important part of the critical appraisal is to identify the applicability of the journal paper to our clinical practice. As we have mentioned, if a good research is done in Malawi, not necessarily that I can apply in my clinical practice in Sweden or in maybe in Kamchatka. I'll not be able to do that, because the demographic is different, the healthcare system is different. But if the journal paper if the research is done in Malawi, I may be able to apply it in the neighboring countries, because they have got a similar demographic characteristics, they have got a similar type of healthcare facilities. If we want to participate in a journal club discussion, we need to go through the critical appraisal of the paper in a systematic way. And the easiest way to do it is by using some checklists that I'm going to show you in a minute. So that is a big advantage of learning the skills of critical appraisal. And of course, to pass the exams. If you do the bachelor's degree or master's degree or PhD degree, you need to do lots of assignments, you need to do lots of dissertations and theses, and this is all about critical appraisal. If you participate in a research project, and if you are given the task of writing the manuscript or reviewing the manuscript, you need to go through those reference articles and you need to find out, you need to do the critical appraisal of those papers to write actually a good manuscript. Especially the introduction and discussion sections, they are all about critical appraisal of the reference papers. So, in short, there are a lot of advantages of learning the skills of critical appraisal. First of all, to combat the information overload, to identify the papers that are clinically relevant, to examine the reliability of the study, the validity of the study, to distinguish good science from bad science, to recognize the bias, to explore the applicability to our clinical practice, and also to participate in a journal club, to write a research paper, and to pass the exams, to write dissertations, theses, and assignments. So you see that there are a lot of advantages, and that is what we are going to show you here. So let me tell you a little bit about the bad science and the good science. We want to identify what is a bad science so that we can remove them from our clinical practice, and also we need to identify what is good science so that we can actually apply that particular piece of evidence to our clinical practice so that we can provide a better care of the patients. Now let me show you this interesting example. 100 years ago, a lot of the American newspapers used to publish these ads that cigarette was good for the patient, for the people, and who were promoting that cigarettes? These are doctors. The doctors, thousands of doctors, participated in some research, so-called research, and they showed that the cigarettes, especially the specific brand cigarettes, were actually good. For example, this is an interesting. I think there was this survey. So what did they do is this Lucky Strike cigarette company, they gave the cigarette boxes to the doctors and invited them to some conference or some meals or something, and then they took a survey, and then they came to the conclusion that there was 20,679 physicians. They agreed that the Lucky Strike cigarettes were less irritating, and it's toasted, it's brilliant, it's good. And this is another doctor who is advocating that this particular cigarette, Camel cigarette, it is better than other cigarettes. Again, this happy doctor in the US, he is saying, "Oh, this is so beautiful. This is so good. This particular Camel brand cigarette is the one that people should smoke. Smoking is good for you." Okay. So these are the ads which are based on some spurious survey, which is not necessarily a very good piece of evidence, but they twisted the facts and they put this in the newspaper. Now, as a non-medical personnel, what they will do? They will be misinformed. So they will think that, well, this is a very good cigarette. Even the doctors are advocating this. So let's smoke. And God knows how many of them have got lung cancer and how many of them have got stroke. We do not know. But what I'm trying to say is, all that is written is not necessarily a good piece of science. All science is not a good science. A lot of naughty people will say, "Why you are not following the science? The science says this and science says that." Hang on a moment. You're talking about science, but is it a good science or a bad science? So how do you spot a bad science? One of the ways you can find that in a newspaper or in the social media or in the TV, maybe you will find sometimes the sensationalized headlines. Even in medical journals, you will see sensationalized headlines. If you don't write a sensationalized headline, people will not read it, right? So Hello. So this sensational headlines sometimes can be a red flag. Um, as I mentioned, that the results can be twisted to serve the interest of the vested groups. So we need to be very careful when we see the interpretation of the results. The good thing is that there should be some tables and charts and graph images. We need to interpret ourselves what is written there rather than how the authors have interpreted the results. I have seen multiple papers where the result is in the table, but the authors have interpreted in complete different way. So we need to be very careful about that, because this the way this is interpreted may be quite wrong. Then there may be some conflict of interest. So many companies will employ scientists to carry out and publish the research, but obviously they are the employees. They are getting some funds. So what they write may not actually reflect the truth. There may be some bias in it. So we need to be very careful about that. Correlation and causation or cause effects may be a very complicated thing. If you look it in a very simplistic way, that this is the cause and this is the effect, you may actually miss the whole point, which is the correlation between the cause, between the two different things. The way the conclusion is written at the end of the paper, we need to find out if the conclusion actually is reflected in the result and in the methodology section. Because again, the methodology section and the result may be one, but the authors may conclude completely different way. Sometimes in the abstract, they write a little conclusion. It will not be appropriate to believe what is written in the conclusion without reading the methodology and looking at the full results. Because this is where the problem may lie. Sample size is very important. So most of the papers have got some statistical analysis on what is the minimum sample size, and we need to identify if that minimum sample size has been, how it is calculated, and if that minimal sample size actually is achieved. The more larger is the sample size, the better, because that will reflect the representative results. Now, again, if the sample is not the true representative of the population, then the result may not necessarily reflect what happens to the actual population or the select group of the population. Obviously, a randomized control trial is a good study in the sense that there is one control group and one study group, so that we can compare and contrast between these two to identify whether that particular intervention or particular drug is actually working or not. If there is no control group, it's not possible to compare between two groups. So if there is no control group, usually this is not a very good science. A blinding is a very important tool as well. So blinding means both the clinician and the patients are not aware what intervention is given, what drug is given, or what treatment is given. So that is the blinding process. If there is no blinding, that means this is probably not a very good piece of evidence. There are many articles where the results are cherry picked from here and there, that is not a good sign. That is a bad sign. When the result is reported, it should be explicit. Everything should be given, both positive results and negative results. If someone focuses only on positive result and completely ignores the negative result, that is cherry picking, and that is selective reporting, which is a sign of bad signs. And as I have mentioned several times, that the methodology should be explicit so that we can use the same methodology to get the same result. If the methodology is not very clear, rigorous, then the result may not be reproducible. So it has got low reliability. And the last but not the least is peer review process. Any good journal article should have a very thorough peer review process. And during the peer review, a lot of fallacies, a lot of weaknesses of the journal paper can be identified. I am a peer reviewer of a couple of journals, and most of the time I find that the article is of very poor standard. Then I advise the editor or editor-in-chief what to do with that, either reject or accept with minor review, and sometimes measured work needs to be done before it is accepted. So peer review is very important for any type of published journal. So you cannot get any paper published without peer review, right? Sometimes 2, 3, 4 peer reviews and multiple submissions, resubmissions are required before it gets published. So there is a good check and balance system before a journal article is published. So in summary, to identify the bad signs, we can look for the following 12 points: sensationalized headlines, misinterpretation of the results, conflict of interests, for example, funding, correlation and causation, unsupported conclusions, problems with sample size, under-representative samples used, no control groups, no blinding, selective reporting of data, unreplicable results, and non-peer-reviewed materials. So that is how to identify bad signs. So this is a type of critical appraisal. Let's talk about a little bit about bias. There are lots of different bias. There is selection bias. There is something called the publication bias. If certain article is submitted and accepted for publication, there may be some publication bias to that particular paper. If the published article is in English literature, there is something called the Tower of Babel bias or language bias. So that is sometimes can be a little bit difficult, because this particular journal article not necessarily is reflecting what is happening to the non-English speaking countries or non-English speaking patients, for example. Published in a journal indexed in literature database like PubMed or Sinahall or Cochrane databases. This is called database bias. If the journal is cited by other authors, that is citation bias. And of course, if there is same article is published repeatedly, this is called multiple publication bias. Ethically and legally, the same article cannot be published in more than one journal, but sometimes it happens, and they twist the fact a little bit, and then that can be published in a different journal with a different heading. Now let's talk about the study design. This is a very important component of the critical appraisal. There are basically two different types of the study design. One is a qualitative study and the other one is a quantitative study. The qualitative study is looking for non-numerical data. So there is no number. This is just the quality, right? And there are different types of it. For example, a document, which is a study of documentary accounts of the events like the meetings. A passive observation, which is a systematic watching of behavior and talking about the natural occurring settings. There is something called participant observation. So observation in which the researcher also occupies a role or part of the setting in addition to observing it. So they are part of the sample. An in-depth interview or surveys. So that is and also focus group, which is a method of group interviews, which explicitly includes and uses the group interaction to generate the data. So this is about qualitative studies. So qualitative study is the type of a study which does not have necessarily numbers or numerical variables. This is non-numerical or qualitative variables. On the other spectrum, we have got quantitative study, and most of the studies are quantitative studies. For example, to start with a case report with a single patient. If there is more than one patient, we can write a case series. And we can do a case control study. So there are two groups. One is a case and the other is a control. And we can do some contrast and compare retrospectively. And this is useful to identify the causation of a particular disease process. And also to identify the causation and also for prognosis, we can do a prospective study of certain cohort of the patients. This is called a cohort study. At the higher level of the hierarchy of medical literature is, of course, we have got the randomized control trials. Most of them are blinded, sometimes double-blinded. So there are two groups usually. So in one group is the study group, the other one is the control group, and they're usually blinded. And the samples are chosen in a randomized way. Usually computer-generated random numbers are given, allocated to these patients. When the literature, usually randomized control trials, are systematically reviewed, for example, PRISMA methodology, then that is the systematic review. And of course, we have got another way of doing the quantitative study is meta-analysis, which means take all the results from different randomized control trials, pull them together, and find out what is the bigger picture. That is a meta-analysis. There are also other type of quantitative studies, for example, cross-sectional study, for example, the surveys, and also the decision analysis and economical analysis. So this is a little pyramid. At the bottom of it, we have got the expert opinion, editorials, review articles, laboratory studies. And at the above it, we have got the case reports, case series, case control studies, and cohort studies. And then above it, we have got the randomized control trials, which are prospective studies. And then when we do the systematic review of these randomized control trials, that is systematic reviews and meta-analysis, on the top of it, we have got the synopsis and other synthesis of evidence. And of course, at the highest part of it, that is the evidence-based guidelines, which are specific for the particular clinical scenario so that we can apply that in clinical practice. Now, if you are given a journal article, where are you going to start? You need to start in a very systematic way, and the easiest way to start is by looking at the various checklists. The one that I really like is the EQUATOR Network. I will show you some of the examples of this EQUATOR Network.org website materials, and you can use it in your clinical practice as well. There are some materials in the CASP as well. I'll show you that as well. And from Scotland, they have got this sign guidelines developers handbook, which is a big PDF file. It's very difficult to identify what the materials are, but still you can go through them. Personally, I don't use this particular piece of material from the University of Oxford Evidence-Based Medicine Center, but if you are interested, you can go through that as well. I'll show you all of this. So let me show you those pieces of materials, then we can go through the critical appraisal papers. Actually, I'll show you later. Let me show you how you can write the critical appraisal of a paper in a systematic way without going through the detailed checklists. I'll show you the checklist later in a minute. So these are the key questions you need to answer in case of the critical appraisal of a paper. First of all, is the study question relevant to my field? So if you want to do the critical appraisal of papers on human patients, it is not relevant to review the article which is done on dogs or cats, in simple terms. So that is this particular study actually is relevant to my clinical practice? So that is the relevance that we need to look for. Does the study add anything new to the evidence, or are we going to reinvent the wheel? There is no benefit of reinventing the wheel. If it is there already, it is there. Okay? So if there is something new, we need to identify that and we need to find out if actually it is helpful. What type of research question is being asked? Very important. When we talk about research question, we need to find out the components. Any research question has got 4 components. These are P for population, I for intervention, C for comparison or compare, and O for the outcome. So, for example, I have given you one of my studies which we have tried to find out what happened to the patients with the wrist fracture who were managed in the emergency department in the long term. What is the functional outcome? So the population is the patients with wrist fracture. Intervention is the manipulation or the plaster of Paris application in the emergency department, and operation in the theater if required. Comparison is we try to compare between those who are treated with conservative management and those who needed open reduction and internal fixation. And then outcome. We try to find out what happened in the long term, in 5 years or 10 years time, in terms of their functional outcome. We used a specific tool called DASH questionnaire, or the disability of arm, shoulder, and hand scoring system. So there are 30 different questions, and we have to go through them with every patient to identify what happens to them, and that is how the research question is answered. The next question is, was the study design appropriate for a research question? We have just mentioned that there can be 2 different types of study design. It can be quantitative or qualitative, right? And is this particular study design appropriate for this particular research? And then we try to find out, is there any bias in it? Is there any selection bias? Is there any observer bias? Is there any language bias? Is there any publication bias? Is there any conflict of interest bias? This type of things. Was the study performed according to the original protocol? So usually if there is a large research, for example, randomized control trial, they publish the protocol at first. And that protocol should be followed. Every step should be followed appropriately. If there is a deviation of the protocol, that means something is not right. So does the study test a stated hypothesis? So hypothesis is the question, the specific question to see if that particular question is answered or not. Where the statistical analysis performed correctly? So usually in a big research, some statistician should be involved. I do my own statistics with R 3.3.3, but as you know that there are newer versions of the R, and sometimes this new software can have some little bit of difference in the way this is interpreted. The reason the statistical analysis is important is because this is the number, this is the science, and how you interpret it can affect your long-term result. And if we don't do the statistical analysis correctly, the whole research result and the discussion and the conclusion can be affected, can be biased, and can have errors in it. So the statistical analysis is very important. Unfortunately, most clinicians don't understand the statistics. They leave it to the statisticians, or sometimes they do wrong statistics. When I did the peer review of many journal papers, I have found so many errors. These are some basic errors, but it is there, and so it was obviously rejected. So statistical analysis is very important, and I would suggest it's very important what is written in the journal article, and if there is an error in it, we need to focus on it, because if there is error in the research, in the result, the conclusion is wrong, right? Now, do the data justify the conclusion? As we have mentioned, sometimes the conclusion can be misrepresented what is actually done in the methodology section or in the results section. So justification is very important. Conflict of interest, especially the funding. And will the results help? That is the most important thing. Can I apply this finding in my clinical practice? If I can't, there is no point of talking about it, right? So this is very important. So before I get into the summary, let me show you some of the examples so that you can understand what I'm talking about. So this is the EQUATOR Network, which stands for Enhancing the Quality and Transparency of Health Research. I think this is a fantastic tool. This is free. So you can go through this website, equator-network.org, and there all these checklists are there. For example, if you want to do a systematic review, then there is the PRISMA guidelines. If you want to do a randomized controlled trial critical appraisal, there is CONSORT checklist. If you want to do an observational study like a cohort study or a case control study or a survey, you can use STROBE guidelines. If you write a study protocol, which is a really very strong piece of evidence, you can use the SPIRIT guidelines. For diagnostic or prognostic studies, you can use the START guidelines. For case report, you can use the CARE guidelines or checklist. For clinical practice guidelines, you can use AGREE. For qualitative research or descriptive research, you can use this SRQR checklist. For the animal preclinical studies, you can use ARRIVE checklist, and for quality improvement studies, you can use SQUARE checklist. For economic evaluation, CHEERS checklist can be used. Let's go through one of them because we use this quite often. For example, if you do a research which is not a randomized controlled trial, probably it will fall into the observational study. So if you click on it on the STROBE section, then there will be these different checklists. There are different types of studies, as you can see here. One is for the cohort studies, which is usually a prospective study, a case control study, which is usually a retrospective study, and we have got the cross-sectional study like a survey. So let's do a prospective study. So if we do that, then let's open up this PDF file and let's zoom it up a little bit. So this is a STROBE statement, and it says that the first thing we need to look at is a title, an abstract. So this particular study indicates the study's design with a commonly used term in the title or the abstract. So that's why you will find that the title is usually quite long title. It is not like 2 or 3 words. It's a long title because the title itself will give you some idea about what this is all about, right? For example, in our study which I published a few years ago, the title was the management of the distal radius fracture, the outcome measurement of the distal radius fracture in the emergency department with the disability of arm, shoulder, and hand dash questionnaire, an observational study, retrospective observational study. So you have mentioned everything. So this is an observational study, and this is done retrospectively, and this is done in the emergency department, not in the GP practice or in the urgent care setting. This is not done in the from orthopedic point of view either, because we are the clinicians who dealt with these patients initially. So this is done in the emergency department. And we have done about, we have written about what is outcome. The outcome is the long-term functional outcome of the patients using specific tools. There are a lot of different tools. One of the tools is the DASH questionnaire. We use the DASH questionnaire, not the quick DASH, but the actual DASH. So that is the title of the study that gave some rough idea about what this study is all about. And then it provides in the abstract an informative and balanced summary of what was done and what was found. And most of the time, if you want to know what this journal is all about, just read the abstract. The summary is there, the synopsis is there, the main cream is there. However, if you want to do the critical appraisal, you need to go through the whole journal article. Because if you don't understand the methodology and the full result and go through the tables and the graphs, you will miss some important things. As I have mentioned, the authors might have misinterpreted the results in a completely different context. And the conclusion may be absolutely different than what is actually written in the tables and the results. So that's why the abstract is good to get some rough idea about the paper. But if you want to do a critical appraisal, you need to go through the whole paper. In the introduction section, the first part is the background and rationale, why it was done, and what was the objective, what is tried to find out, right? Is there any specific research question looking for any specific hypothesis, right? In the methodology section, the authors should explicitly mention the study design, whether it is a qualitative, quantitative, and as we have mentioned already several times, the study design should be mentioned. And then the setting should be clearly mentioned. For example, what is the location? Is it one hospital or multiple hospitals? What country was that? And what is the relevant date that is important? And what is the period of recruitment? What was the exposure and what is the follow-up and how long the follow-up was done? Usually most of the time, at least 6 months of follow-up should be done. And how the data was collected. Was it collected from the medical records, from the electrical records, or was it done from the patient themselves by filling up some forms? A specific mention should be done about participants. So what are the eligibility criteria? Was there any specific inclusion and exclusion criteria, right? So that should be done. How the follow-up was done. For matched studies, give matching criteria, number of exposed and unexposed patients. For the statistical analysis, it should be mentioned what are the variables. So clearly, the definition should be there about the outcome, exposure, predictors, potential confounders, and the effect modifiers. Give diagnostic criteria if applicable. And then the data source or measurement. For each variable of interest, give sources of data and details of the methods of the assessment. Describe the comparability of assessment method if there is more than one group. As we have mentioned, bias should be identified and how this bias is actually addressed, that should be described as well. A specific test should be done to identify what is the minimum sample size and how that particular sample size was calculated. In case of the quantitative variables, explain how the quantitative variables are handled in the analysis. If applicable, describe which groupings are chosen and why. It's all about rationale. Why you have done it? It should be clearly mentioned. Statistics is very, very important, and most clinicians, honestly speaking, have got some weakness in maths and statistics. So first of all, the statistical methods should be clearly described, including those used to control for confounding. Describe any methods used to examine the subgroups and interactions. Explain how the missing data were addressed. Especially if it is a retrospective study, many pieces of missing data may be there. The way some of the softwares work, for example, in R, you can just write the code in such a way that particular boxes in the data set which are absent, they will just ignore it. Now, how that is addressed, that is very important, because if some important data is missing, then the whole result can be affected. If applicable, explain how loss of follow-up was addressed. Now, this is important because the follow-up period might show some complications. So if that particular intervention has some complication in the long term, that needs to be picked up. And describe any sensitivity analysis as well. The next section is the results. In the results section, usually the results are short in terms of the text, but most of the time results are written in the tables and graphs and charts and different flow charts, this type of things. So report numbers of the individuals at each stage. Usually there should be one table for the demographic variables and patient characteristics. And other tables should have the actual results of the intervention and the outcomes. So give the reasons of non-participation at any stage and consider use of the flow diagrams. These are the figures which are visual images, easy to understand. For descriptive data, give characteristics of the study participant, as we have mentioned, the demographic characteristics and clinical characteristics, social characteristics, and patient characteristics. And indicate the number of the participants with the missing data for each variable of interest. And summarize the follow-up time, for example, average and total amount. In case of the outcome data, which is very important, and this is where the money is, this is where the actual result will be shown. So report the numbers of the outcome events or the summary measures over time. And of course, the main result should have a unadjusted estimates, if applicable, confounded adjusted estimates and their precision with 95% confidence intervals, and make clear which confounders were adjusted for and why they were included. Report category boundaries when continuous variables were categorized, and if relevant, consider translating estimates of relative risk into absolute risk for the meaningful time period. So subgroup analysis is important. Now in discussion section, of course, we are trying to compare our finding with the relevant literature, which is already there. So it summarizes the key results with reference to the study objectives. Now one section, as I mentioned, should be for the limitation of this particular study. Especially at the end of the discussion, there should be a separate section, but at the same time, the limitation should not show a lot of limitation that actually make the whole study irrelevant. So there should be some short but crispy discussion of the limitations, but the most important is how these limitations were addressed, taking into account source of potential bias and imprecision. Discuss both the direction and magnitude of any potential bias, and as I've said, most importantly, how they are addressed. And interpretation, give a cautious overall interpretation of the results, considering objectives, limitations, multiplicity of analysis, and results from similar studies and other relevant evidence. Another important point is generalizability. Is this study actually representing a large population? Is it generalizable? Usually, if a study is done in one center, that has got poor generalizability. If the study is done in multiple centers, that has got higher generalizability, so higher applicability as well. In the conflict of interest, we need to keep an eye if there is any conflict of interest. So that is, in summary, about the STROBE checklist. It's very easy to follow. You can just go through each point and find out if it is followed or not. So this is about just for the observational study. Similar guidelines are there, or checklists are there for randomized control trial, systematic review, the study protocols, diagnostic protocol, even case report. They have got some checklist. Please use this checklist next time you do the critical appraisal, and you will find that this is a piece of cake. It is not that difficult. The another checklist is the CASP checklist. Again, they have got the similar type of checklist for cohort study, qualitative study, case control study, and also they have got systematic review, randomized control trial. I'm not going through them, but if you're interested, you can go through this particular website. It's called casp-uk.net/CASP-tools for dash checklists. Now this is from Scotland, and in the sign handbook, it's called sign 50, but it's a bit old. This is the latest, and that is from November 2015. If you are interested, you can download it and go through this. I find it a little less user friendly, but again, if you want to know a little more, you can just go through this document. From Oxford, there is another one that you can use from the CEMB, Center of Evidence-Based Medicine. But personally, I like the EQUATOR Network, and I find this really useful. All right, so let's do the summary now, what we have done so far. So we have talked about what is critical appraisal. So this is a systematic way of identifying the validity, reliability of the study, and also the applicability of the study in clinical practice. And we have talked about why you need it. There are so many advantages that it will be not very wise not to master these arts of critical appraisal. If you follow those checklists, if you follow the guidelines, what I have talked about, it will not be that difficult. So we have talked about the various steps of writing the critical appraisal, and also I have shown you some tips and tricks, and we have shown you some examples, and my personal favorite is EQUATOR Network checklists. But if you like, you can use the other checklists as well. And if you follow this, it will take a little bit of time, but ultimately you will get there, and it is not that difficult. All right, so thank you very much for your patience and watching this video. If you still have got any further questions, please drop me a line. And if you have not done already, please subscribe to the channel, share it with others. If you find this video a complete waste of your time, share this video with someone you hate so that they get annoyed as well. All right, thank you very much. If you have any comments, please write below in the comment section, and we'll try to answer to your questions as soon as we can. Once again, thank you very much. Have a good day.